Just want to say good afternoon and welcome everyone. And thank you for joining us today. This webinar will be recorded and it will be on our YouTube page once we're done recording and editing it. I just want to introduce you all to our presenter, Trevor Braun from Physicians Mutual. Trevor's here to give us some valuable insights on what Physician Mutuals offers and to let us excuse me, so we can all just give Trevor a good warm welcome and thank you for presenting today. Go ahead, Trevor.
Awesome. Thank you, Ms. Shakita, for the nice warm intro, and good afternoon, everybody. Thank you so much for taking time out of your busy day to come hang out with us. I am broadcasting here live from South Louisiana. You can see my LSU shirt. Ms. Shakita was giving me a little flack on that because she's a Miami Hurricanes fan. But as I pointed out, there's only one of those two teams that is at the College World Series. So I don't know, maybe some of you Florida folks are rooting for the Chanticleers. But man, if you can find it in yourself to root for LSU tonight, we could certainly use some help against Arkansas. But it is really a pleasure to be here, guys. Looking forward to being able to meet some of you that will be at the event next Friday. Myself and my regional, Mr. Andrew Saul, do plan on being there. So make sure to stop by the Physicians Mutual booth, give us a high five, say hello, ask some questions. But for now, we got a little training to get to. So let me get to sharing my screen here. Miss Shakita, we good?
Yes, we are.
All right, let's rock and roll, guys. So, again, my name is Trevor Braun. I'm sales director here with Physicians Mutual. Been with the company almost 19 years and really love this place and love insurance, love Medicare. So looking forward to sharing some of that wonderful stuff with you. What I like to do whenever I'm doing any type of product training, I like to start with our product availability map. That way, because I know we're going to have agents on here that live in different states, agents on here that write in different states, regardless of, whatever your resident state is. And as you can see, we are not in every single state, but we are in most. Okay. So we do offer MedSup and couple of different ancillaries. We're really going to drill down strongly in our MedSup portfolios, and we are also going to take a look at our dental as well. Okay. Now we do have 3 different MedSup portfolios going on at one time right now, and 2 different dental portfolios. All of that simply just has to do with what individual departments of insurance have approved, because as you may be aware, of course, CMS, the federal government, regulates Medicare parts. But when it comes to supplements, those being actual insurance products, those are regulated by the individual departments of insurance. So, we are working to get into more states, and the black tic tac, if you can see, we call this the tic tac map internally here, so you can probably tell why. But that black tic tac there, that's going to be our most innovative portfolio. Okay. We are working actively with Florida and Georgia right now to get that in there, along with Missouri, Kentucky. We are working to get MedSup in states like Maryland, Michigan. So we do have some great plans of expansion, and we still do have MedSup in Florida, Georgia, Kentucky, Missouri, just not the bells and whistles that we have in some of those other places, as you'll see here in a little bit. And then all states that we have dental in, that little blue tic tac there, light blue, that's going to be the majority of our dental states. And if we do have any writers in the state of Nevada, then I will go over that briefly. There's just some different nuances there with our dental in Nevada. Okay. But without further ado, let's get on to the products. So this is what is called our Medicare Physicians Select Insurance Company. So first things first, there's MedSups and then there's Medicare Select plans. We only sell MedSups. This was poor choice of wording as far as the name of the company is concerned, in my humble opinion, because that does confuse agents from time to time. But there's Physicians Mutual, Physicians Life, and Physicians Select, all under the Physicians Mutual umbrella. This just happens to be the paper that we are writing our most innovative. portfolio on currently. So I just wanted to clear that up in case there was any questions regarding that. Simply the name of the company, and that's it. So in all these states here seen above, we've got three, not one, not two, but three Plan Gs. Of course, most carriers that you're used to are going to have one Plan G, standard Plan G, maybe a second with the high deductible G. Well, we have a third, and that is exclusive to us. It's actually a patented product called the Innovative G. Okay, so we should all be familiar with how the regular G works, right? Okay, it's going to cover all Medicare's deductibles, copays, and coinsurances, with the exception of the Medicare Part B deductible this year, $257. Hopefully, you're familiar with the high deductible as well. That is a Plan G that has an out-of-pocket maximum or a plan deductible. I really like shaping it more as an out-of-pocket maximum because that's really what it acts like. Because, of course, Medicare's primary, the supplement secondary. Therefore, with a high deductible G, the customer has a $2,870 plan deductible, i.e. out-of-pocket max, and where they would actually, they being the customer, would act as their own Medicare supplement, cost sharing, and paying any deductibles and coinsurances under Part A or B until their out-of-pocket max reached $2,870, at which point then the plan is going to kick in 100% for the rest of the year. Now, with that traditional high deductible G, that plan deductible, that out-of-pocket max, which is set by the Department of Health and Human Services annually, changes every January, or resets, should I say, every January for the life of the policy. Okay. What makes the Innovative plan unique and different is it's going to start out just like the high deductible G. Same exact plan deductible, i.e. out-of-pocket max, working the same exact way, customer paying any deductibles and coinsurance until their out-of-pocket reaches $2,870. The difference is instead of that $2,870 or that plan deductible resetting every single year that the customer has that plan, it'll reset until January 1st following their second policy anniversary, at which point that plan deductible goes away forever, leaving the customer with a regular full-blown Plan G for the rest of their life at a discounted premium for life. So we will go more in depth into the Innovative G, just introducing it. So it is a hybrid Plan G that has a temporary deductible that offers a lifetime discount on those full Plan G benefits. Keep that in mind. Okay. Now, state of Pennsylvania, same G's, but we got to add a B as well. One of those, goofy rules there with their individual Department of Insurance. And then California, get this, they felt the Innovative was an unfair competitive advantage for Physicians Mutual, so they did not approve it there. So we have our standard G there in Cali. Okay. But there will be some other bells and whistles we'll talk about with relationship to this portfolio going forward here in a little bit. So exclusive features, okay, a little bit being now. So we just mentioned the Innovative again, not in California, but it does have that temporary high deductible with those discounted Plan G rates for life. When we talk about preventive care, we'll get to that on the next slide. But in areas where the client has unlimited preventive care, either as a rider or built into their policy, something that is exclusive to Physicians Mutual, those preventive benefits do not go towards the plan's deductible. Those are all paid 100% from first dollar. You may be quoting Physicians Mutual in different areas and you see a couple of different prices for our Plan G, an unbelievably competitive premium for our Innovative, in some areas under $100 a month, all the way up to a competitive standard Plan G premium. So that's why, because you may be seeing both the Innovative and the standard G. And again, the whole point behind this is, if the customer is willing to cost share with Medicare, have that small out-of-pocket max, small compared to what most of them are coming off of with individual or group insurance, they're willing to have that for the next 2 to 3 years. then Physicians Mutual is going to be willing to reward them with those full Plan G benefits for life at that lower premium. So in such a unstable Medicare supplement rate environment, with a lot of insurance companies taking a lot of pretty gnarly rate increases these past couple of years, the innovative certainly can be a wonderful, wonderful solution for that in the markets where it's available. When I talk about preventive care, okay, Medicare covers some, but not all preventive care. So when I'm training on preventive care, I train on 3 different scenarios. One being preventive care that Medicare approves, and it's done within Medicare's approved or Medicare's allowable frequency. Okay, if it's something Medicare approves and it's done within Medicare's allowable frequency, all med sups being standardized, right, are going to cover the same. Okay. However, when it comes to preventive care that Medicare approves, but it's done more frequently than Medicare approves it, I do have some examples coming up. Or when it comes to preventive care, Medicare does not approve at all, also have some examples coming up. That's where Physicians Mutual's unlimited preventive care benefit is going to come into play. Again, this is exclusive to us in all states other than Wisconsin, where that is a state mandate where additional preventive care above what Medicare approves is built into all SUPs there. But yeah, when it comes to those 2 instances or those 2 scenarios, we're going to be covering preventive care with no maximum on that, where other med sups will say, sorry, Medicare didn't approve it, so we're not going to cover it. So bottom line, I do have some slides coming up to kind of dive into preventive a little bit deeper. But bottom line is, when they have this unlimited preventive care benefit, they will have access to unlimited preventive care. And again, doesn't matter if Medicare approves or denies it. If it is coded preventive, we will cover it 100%. Okay. And then 2-year selection guarantee, just kind of a cool deal. We've all got those folks that kind of paralysis by analysis, the fence sitting kind of prospects or customers, where they know they want to go with you. They know they want to go with the company. They're just not sure what plan they want to go with. This kind of helps to take all of that stress and that reluctance of the process out off the table and get the customer to make a move. And that is within the first 2 years of them having a Medicare supplement through Physicians Mutual, they can actually change plans up or down without having to prove insurability. So, an extreme example would be, you get a customer that decides they're going to go the high deductible route. And then all of a sudden they're like, man, if situations change, health's changed, finances change, whatever. Well, so in the first 2 years, they can actually upgrade to the standard Plan G without going through medical underwriting. So just offers a lot of freedom and flexibility is all. And then, pardon me, something that is not necessarily exclusive to Physicians Mutual, but still, not super common on the Medicare supplement side, is a added value partnership with Silver and Fit. So, different organizations, some different companies, it might be Silver Sneakers, might be Renew Active, Silver and Fit, after Physicians Mutual did a review of, several of those out there, felt that this would be the best fit for our customers. And we started this partnership with them back in 2023. And, more than this, but, no cost access to, and forgive me, these are some slightly outdated numbers. It's well over 16,000 fitness centers now, including YMCA. Also to your more, your more premium, more bougie fitness centers. They do give discounted memberships there, tons of workout videos, social media classes and channels, private coaching, no cost at-home fitness kits, just a lot of really, really good bang for their buck with that added value partnership there. Okay. So what I'm going to do for you guys now is really break down those top 3 things. Okay. We're going to spend some time on the innovative, make sure we're comfortable there. We're going to spend some time on the preventive care, make sure we're comfortable there, and then do the same on Silver and Fit before moving on to a few other items that y'all need to know about our med sup. So why innovative? Okay. Again, this is something that's catching a ton of traction, guys. And I get it. We as agents, we're human, and typically human nature is taking the path of least resistance, because a med sup is a med sup is a med sup, right? Well, not always, especially when you're introducing Physicians Mutual into the mix. So you certainly as an agent have to commit to, okay, learning this and figuring out, how to best, in your words, explain it to the prospect, it is a little bit extra step, but with a plan that, like I said, is gaining tons and tons of traction in the market right now, crazy rate environment, a plan that has a 97% persistency, meaning that 97% of folks do not leave this plan, and that 3% that does leave does factor in mortality. So this is a wonderful opportunity for you to really be able to continue to build that book of business with new lives versus having to play the game of switching clients from carrier to carrier every year because the dang rates have gotten crazy. So it does really help lower that premium for life. Again, it starts out as a high deductible G, will automatically convert to a standard G January 1st following the third calendar year. But it's always comforting to know that there's a back door, right? There's an exit if need be. So again, going back to the fact that we understand, right? Flexibility is key. People's finances change. People's health changes. So what's kind of neat about it too is that at any point during that plan's deductible period, if the customer decides they do not want to have that plan deductible at out-of-pocket max anymore, they can simply send a letter to Physicians Mutual signed and dated asking to be put back on the standard plan G, and they can do that at any point, and they will be put back on standard plan G benefits the first of the following month. Now, if they do it manually with that letter, they'll not only be put back on standard plan G benefits, but they will be put back on standard plan G premiums. The beauty in this thing is going to be when they allow that that plan deductible, that out-of-pocket maximum, to disappear automatically when it's supposed to. Okay, so visuals help, right? Pictures worth 1,000 words. Sometimes agents and clients alike kind of, man, I'm having trouble getting my head around when this deductible is going to go away. Is it 2 years? Is it 3 years? Yes. So bottom line is, the easiest way to think about that plan's deductible period and the elimination date when that deductible is going to go away is going to be from whatever the effective date is. They will have that plan deductible for the remainder of that first year, from whatever that date is to December 31st. It'll reset the following 2 years. And then that next January, they will wake up with full-blown Plan G benefits at a discounted premium for life. So as you can see, in a January effective date situation, well, that's 3 full years. So January of 25, they'll have it all of 25. It'll reset again 26. They'll have it all of 26, and it'll reset again 27. They'll have it all of 27. But January 1 of 28, they're going to wake up with a full-blown Plan G at that discounted premium for the rest of their life. Okay. Same deal if we took a 7/1 effective date. So 7/1 of 25, we've got 6 months left in the year, followed by the next 2 consecutive years. Therefore, that deductible period is 2 years and 6 months, still going away January 1 of 2028, leaving them with that full Plan G for the rest of their life at discounted premium for life. And then in a 12/1 effective date, now they've only got 1 month left in the year. Therefore, it's now 2 years and 1 month, still going away. Again, that January 1 of 2028, having full-blown Plan G coverage for life at that discounted premium. And remember, in any of these scenarios, or any of the other, 9 scenarios, because we only put 3 out of 12 months here, at any point, again, if they choose that they don't want that plan deductible anymore, they can simply ask Physicians Mutual to remove it, and they will be put back on that standard Plan G first of the following month. So another thing that we really need to make sure that we understand, and this is a game changer for a lot of agents in their mind, is how this plan deductible actually works. And in order to understand how that works, we have to make sure that we understand how Medicare works, right? And I know, getting pretty simplistic, but a lot of times, we get caught up and we're just not thinking. So when somebody has already met, and we'll assume in this example, somebody has already met their Medicare Part B deductible, right? So they've already met the Part B deductible. What percentage of eligible covered charges will Medicare pay for the remainder of the year under Part B? The answer is 80%, right? So in this example, where they've got Medicare, they've got the innovative, let's say they've already met their Part B deductible, they have something that falls under Part B, and Medicare is billed and Medicare approves $1,000. Let's assume that the Medicare doctor is accepting Medicare assignment, so they can't charge the 15% above what Medicare approves. So we're stuck with that straight $1,000 that Medicare approved. How much of that is Medicare going to absorb right out of the gate? $800. So in this example, it's not $1,000 that's going to be put on your client for out of pocket. It's only $200. Okay. So we've got to think about, again, how does Medicare A's deductibles and coinsurance work? How does Medicare B deductible and coinsurance work? And we've got to kind of factor that stuff in. And when we're really honest, and you'll see in a moment when we look at our own stats, without a major hospital stay, guys, it is pretty dang difficult for a customer to even come close to that 2870. Because again, Medicare is primary, the supplement secondary. Medicare is still doing everything they're going to do. This is simply just filling those gaps or supplementing, and the customer's kind of acting as a little buffer in there. But again, that temporary deductible worth that lifetime discount. Okay. Oops, sorry. So, looking at this historically, so I started in 2006 with Physicians Mutual. I say we, people much smarter than myself, came up with this concept and got it patented in 2008. So we have been selling an innovative plan since 2008. So we've got a lot of data, almost and coming up on 2 decades here in a couple of years of data that we can look back and extract some of this from. So showing that only the annual average out of pocket is $518 over the first 3 years. Combined is $1,553 in year one. 97% of people do not meet this plan's deductible, and 82% don't meet it in any one of those first 3 years. Okay, so again, this is a really, really good way. Our home office jokes about it, and they say this plan deductible is the best underwriter we've ever hired. Our innovative business operates at such a wonderful low loss ratio. It actually outperforms our underwritten business. So, having a carrier that is very conscious about that, doesn't artificially set its prices low and operate at a loss for the first several years to take it out of the client's back later on, manages their business, is looking for healthy clients. And then when you add on the preventive care, the silver and fit, really, really solid long-term solution for you and your clients. Okay. Just historically, you may be wondering, well, what was that plan deductible back in 2008? It was $1,900. Okay. So here in 2025, 2870, last year was 2800. Some years it's increased. As you can see, some years it stayed the same. Bottom line is, over the last, 17 years, it hasn't even increased $1,000 annually. Now, who knows what it's going to do next year and the year after that and so on and so forth. But again, they're only going to have it for maximum, if it's a January effective date, 3 years. And if they're ever not comfortable, they can just go back to that standard G. So really where the rubber meets the road, guys, with the power of the innovative is in the cost savings. I kept talking about discounted premiums for life. So let's just assume this is our scenario. Okay. We're assuming a 7% year over year rate increase. We're also assuming that these individuals are going to live to age 80 just for this projection. Okay. Which is a fair assumption. Since, especially females that make it to 65, that's a pretty average age right there, as far as life expectancy is concerned. So when we're looking at this annual difference, you can't just look at year 1 or 2, because if you do, would it make sense to subject your client to a potential 2870 out of pocket just to save $451 in year 1? No. Which is why we have to be looking at this long term. We can't be so short-sighted. We are helping these folks plan for retirement, and we are helping them plan for as long as they're going to be on Medicare, which is typically going to be for the rest of their life. right? So we need to be looking at this through that lens. So in this scenario, picture that you have twin sisters. They come, they sit down with you. One of the sisters decides, you know what? I think I want the innovative. The other sister decided they wanted the standard plan G. Okay, well, by the time those ladies have reached age 68, the sister that took the innovative, her plan deductible is gone. So by 68, let's just say, these ladies have the same exact coverage. You can see the premium's different, but they have the same exact coverage. And if we're assuming a 7% on both sides, you can see that that annual difference gets bigger and bigger and bigger over time. So instead of just judging a plan for the first 3 years when they're different, let's take into consideration the next 12 years where they're the same. And then you look all the way down to the right-hand corner, that total savings. The sister that took the innovative saved $12,583.09 from the sister that took the plan G over that 15-year period. And 12 of those 15 years, they had the exact same coverage. Now, devil's advocate, let's go back up. Sister that took the innovative, let's round that plan deductible up from $2,870 to $3,000. She maxed it out all 3 years, right? That's a total of $9,000 out of pocket. There is absolutely no way that that sister would have benefited from taking the innovative over the G. Well, not so fast, because as you can see again, as long as she lives long enough, which obviously none of us have a crystal ball, us nor them, nor do we know exactly how long they're going to live there? But if she did live to age 80, even if she had $9,000 out of pocket over the first 3 years, again, hypothetical scenario, she still saved over $3,500 on the innovative versus the standard G. So in most markets, we're looking at somewhere between 25 to 35+% difference in that premium between the innovative and the standard G. And that difference, again, will be maintained through the life of the policy. So pretty cool deal. Pretty cool deal. Now, this is a customer-facing piece, kind of wraps everything that I just went over the past 25 minutes or so, 20 minutes or so with regard to the innovative. Okay. It goes through deductible period examples, goes through lifetime of premium savings. They are working on, making these premiums a little bit more realistic for most of our markets, as well as drawing it out to 15 years, because of course 15 looks better than 13. We went 13 out, or excuse me, we went 15 out on this one. You would be seeing that double-digit savings. And then in these green boxes right here, really just showing again how uncommon it is for individuals to actually max out that plan's deductible, which kind of gives you an opportunity to reiterate how it works in conjunction with Medicare. And again, throughout this whole thing, look, start with this. If you're not comfortable ever at any point, let me know and we'll put you back on the standard G regardless of your health. Okay. So going through preventive care and silver and fit. Okay. Now, in a lot of states, this is going to be a rider. In some states, it's built in. Some states don't have all of it. So I put together a little state-specific preventive care silver and fit slide. Follow with me. In Texas, both unlimited preventive care and silver and fit are built into the G and the innovative G, but offered as a rider for $9.53 on the F and the high deductible G. Wisconsin, these benefits are built into all plans. Ohio, silver and fit is built into all plans and unlimited preventive care is only available in the innovative. Pennsylvania, silver and fit's built into all plans. Unlimited preventive care is not available at all. Thank you very much, Pennsylvania Department of Insurance. And all of these other states here listed, preventive benefits plus rider is available on all plans for $9.53. In South Carolina, same rider is available for $9.51. Okay. So as we break this down a little bit further, a couple of examples. First two examples are going to be that second scenario I talked about where it's something that Medicare approves, but it was done more often than Medicare approved it. Therefore, Medicare denied it. So mammogram, you can look up here, breast cancer screening mammogram once every 12 months. Well, Medicare denied this service because it had not been 12 months since their last mammogram. Therefore, if your client was with any other med sup, they'd be out of pocket $250. But with preventive care with Physicians Mutual, we'll pay that 100% all day long. Okay. Colonoscopy, also something that Medicare approves. How frequently? Once every 120 months, every 10 years. Again, this individual did not wait the full time frame. Therefore, they were billed $2,890.08. That would be a big ouch for a senior on a fixed income with a plan G with any other company. Physicians Mutual, we don't care. It's coded preventive. We'll cover it. Okay. This is one that's always had me scratching my head, right? To me, it's something that we should all be doing once a year at least. And that is going to get an annual physical and having some annual blood work run. Okay. Just to make sure that we're healthy. That's why it's called a preventive physical. Well, you have a Welcome to Medicare preventive visit, just a consultation. You have a yearly wellness visit, again, just a consultation. If you look those things up in Medicare and you in bold print, it says these are not physical exams. All right. Medicare ain't gonna pay for that. Physicians Mutual will. Okay. And then this is something I throw in here, just it's called thermography. It's a pretty neat deal where it can have a lot earlier detection of some other scans. If you know anything about the body, anytime something's screwed up, usually gets inflamed, inflammation gives off heat. This thermal scan detects the heat and kind of work backwards with your doctor. Something also Medicare does not approve. We will pay for it. So several different preventive benefit examples here. Of course, you can monetize this stuff. And like the one thing that I train on all the time that I encourage my own clients to do is just what I said. At minimum, go and get you a physical done every year with some blood work. Okay. That's going to cost you about $1,000 if you combine those two things. With Physicians Mutual, however, it's not going to cost you anything. We will pay for that 100%. So if you got a client that's sold on that, all of a sudden, to fairly compare Physicians Mutual to any of the other med sup carriers in your area, either subtract $1,000 from our annual premium or add $1,000 to the other carrier's annual premium. And now for that client that's going to go and utilize those benefits, it's a much more fair comparison. We just became the absolute, not even close, most cost-effective Medicare supplement, regardless of the lowest ball carrier in that market, with that one thing. And the priceless piece of it is not having to wait for signs and symptoms to be present to be able to go and get some of this stuff done. Because as we know, a lot of times once signs and symptoms of something are present, it's too late. And we're trying to not get to that point. And again, when you think about it, guys, when we have more customers utilizing unlimited preventive care, that's going to keep them healthier and it's going to keep them living longer. So less claims with people paying premiums for longer is only going to continue to help our rate stability long-term for everybody. Okay. This is a letter. This is just happens to be one for the state of Wisconsin, but I do encourage the client. This is a letter that's going to come in your policy when it is mailed to you from Physicians Mutual. Bring this to your doctor's office. Make sure they understand if they've got any questions, call customer service. That way you won't get any pushback because we're the only supplement company that does this. And I can promise you those folks that deal with billing and insurance, unless they have Physicians Mutual clients, they're going to tell you that you're full of you know what. Okay. So this is a big piece of the pie there. And then when it comes to the Silver and Fit access, again, lots of stuff here. Workout videos, workout plans, standard and premium fitness networks, well-being clubs, home fitness kits, fitness tracking. Again, there's a ton of different gym opportunities. You can just go on silverandfit.com and see the gyms in the area. Same thing for the premium fitness centers. And then beginning on their effective date and every January following, they can order one of these at-home fitness kits, fitness tracking, swimming, yoga, strength building, all kinds of stuff. And forgive me, these are, again, some older pricings. These have certainly increased since I built this PowerPoint. I've updated some of it, but not all of it. But this isn't cheap stuff. They can get it at no cost, right? So just a bunch of neat stuff there. Okay. Now, we do also operate in the state of Utah, slightly different portfolio there. We still do have the G, the innovative G, the high deductible G. And we do have preventive care built in, but no access to silver and fit. And then again, we are actively working, don't have an exact time frame yet, but we are actively working with the departments of insurance in these states, especially Florida and Georgia. We're trying to get those pushed through because a ton of great agents there. We are working to get a more innovative portfolio there, get access to more of those things that we just looked at, especially the innovative, the preventive, the silver and fit. Still great plan, still a G, still an N. They still have the 2-year selection guarantee. Still some competitive pricings in areas. Don't sleep on our post 65 either for that G and N. And then something that is certainly going to affect all states, regardless of what portfolio they're on, is going to be our discounts and plan features. So if an individual is not using tobacco, then they will save $5 each month when they pay with bank. If they're not using tobacco, they will save 10%. They will save $5 each month if they do bank draft versus monthly direct bill or monthly credit card. And then Florida and Ohio is a little bit different with our household discount. In both of those states, there has to be 2 med sups with Physicians Mutual in the house. And Florida's percentage is 2.5% for that discount. Ohio is 9%. All other states, it is a 10% household discount. And in those states, it does not matter. Let me rephrase that. If the customer is married, nothing else matters. So if they're married, it doesn't matter the age, it doesn't matter the gender, it doesn't matter what insurance their spouse has. Simply by being married, they qualify for the discount. And if they are not married but living with someone at least 60 years or older, no more than 3 people, then they certainly qualify for that discount as well. So one of the more encompassing discounts, if you will, out there, from carrier to carrier. Over 80% of the applications that we do receive from you guys does have that household discount. So that's really a cool deal. And then we do have age banding, ages 65 through 68, and up through 67 in Oklahoma. And then we do, in those same age brackets, have limited underwriting. So just a few health questions under age 69, and going from 1 sup to a lower, like going from a G to an N or a G to a high deductible, something like that. That can always be done, guarantee issue, regardless of the state or how long the customer's been on the plan. So real quick, before I jump into the dental, did see that we had a couple of questions. All right, Steve, looking at MedSup in Kansas at all? Man, not that I know of at this particular time, but certainly hoping that we can get in all states eventually. And do these discounts stack up, Miss Darlene? Yeah, like for instance, if you have a customer that's paying with bank draft that it does not use tobacco and is married, then yeah, I mean, you're talking about 20% discount plus the $5 off. I'm assuming that's where your question was going. Any other questions on MedSup? Great. Any other questions on MedSup before I move on to dental, guys? All right, y'all just leaving me with some easy ones. All right, guys, dental. So this is something that we do have, the top of the line portfolio there in Florida. And all those other states. Again, Nevada is going to be a little bit different. We'll save that one to the end. So highlights, okay? Again, keep dental simple, not near as complicated as Medicare, okay? Our dental is a PPO. So they can go anywhere that they want. However, if they happen to go in network, it's going to work better, right? Just like any PPO would. So the provider network, it is a true physicians mutual dental plan, but we piggyback off of the Emeritus network, okay, which their network is constantly growing. Last update I heard was over 600,000 providers nationwide. And of course, providers in that network, the plan's going to pay, but it's going to pay on a discounted bill, right? So that average nationwide is 36% discount right off top off of those covered services. So what can you expect from all four of our plans? If you go in network, it's going to pay 100% for preventive care. Preventive care and basic care do not have a waiting period. Major care's waiting period is 12 months. There is no deductible and there is no annual maximum, no annual cap on our plans. Okay. The one thing that does have a cap, and it's a lifetime, not an annual, is implant. And that would be $1,000 lifetime max on implants. Now, when I say that, I'm talking about the actual metal rod, the post, the implant itself. There's going to be plenty of other stuff done around that implant that's going to fall under the plan itself. But for the actual post, that is $1,000 max. And those could range from a couple to a few $100. Okay. So as we are looking a little bit further here, I strongly suggest you guys always lead with the Premier. This is by far our most sold and our most comprehensive, 71% plus of the dental plans that we see sold nationwide is the Premier plan. Okay. And what that's going to do, again, it's going to have no deductible. It's going to pay 100% immediately in network for preventive care. It's going to pay 70% immediately in network for basic care. After 12 months, it's going to pay 70% in network for major care. And there is no cap, no maximum on what it would pay. Okay. So that is pretty solid stuff, guys. Find another 70-30 plan out there that has no cap on it. Oh, wait, I don't know of one. Maybe there is, but I don't know of one. Now you may be thinking, man, that price tag on that must be unbelievable. $56 a month. Okay. 56 and change. But for that type of coverage, that is a heck of a deal. And the only time that I would really pivot to the preferred standard economy is if they give any pushback on that premium, right? Because we do have three other choices: preferred standard economy. All three still pay 100% in network for preventive. However, when it comes to basic and major, the preferred is going to cover roughly 55%, the standard roughly 40%, and the economy roughly 25% respectively. And I say roughly because these plans for basic and major are actually going to be more of your set dollar amount per procedure type plans. And what we did, just make it easier to see and explain, is take those set dollar amounts, compared them to the average maximum allowable charge nationwide, and came up with some roundabout percentages there. Okay, the preferred is going to be about $46 a month, standard about 38, and economy about 30. On any four of those plans, you can add vision and hearing for $8.95. What makes most sense for you? Okay, so very easy, very straightforward. Don't overcomplicate stuff. Of course, you're going to have questions from customers, some of those real analytical folks. We do have a very comprehensive dental reference manual. And of course, the best thing to always do is, you can reach out to me. You can reach out to our home office. And if the customer just has to have, hey, I need to know what this is going to cost, then, hey, go see your dentist. They can draw up a pre-treatment estimate, right? So when it comes to the optional vision and hearing rider combined, you can't separate the two. Either they get vision and hearing, or they don't get vision and hearing at all. The eye exams is going to be up to $100 per person per year. Vision correction, which is contacts, eyeglasses, things of that nature. After a 3-month wait, $150 per person. And then when it comes to hearing exams, every year up to $75 per person. And after a 1-year wait, after 12-month wait, $500 per hearing aid per ear. And that does reoccur every 5 years, that particular hearing aid benefit. Now, A lot of times people have questions about the VSP network and how that works in conjunction with the vision. Think about it kind of like the relationship between the dental and the emeritus network, where they can go anywhere with the dental. However, if they use the emeritus network, they'll get discounts. Same thing here. They can go anywhere with the eye stuff, but if the vision provider uses VSP, they will get these benefits on top of these discounts. Okay. Question we get a lot: is this just for seniors? The answer is no. Okay, if you're 18 or older, you can have your own plan. Under 18, you can be on a parent's plan as a dependent. That may vary a little bit age-wise by state. But all in all, we can do an individual. We can do an individual plus spouse. We can do a single parent with one or multiple dependents. Doesn't change the price regardless of the amount of dependents you have. And then we can do an all family. We can do it with or without the vision and hearing. And then you may also notice another discount to stack up, Miss Darlene. And that is if they have or if they are doing the Med Sup with Physicians Mutual, we will give them a little 5% discount off of that dental. So I know a lot of times agents are always looking for smooth, easy ways to bring cross sales into the equation, without sounding like a, hey, you want to buy a watch kind of deal. And that's a great opportunity. Hey, look, Miss Shakita, now that you were a Medicare supplement customer with Physicians Mutual, I know that you had mentioned, some dental insurance. I can actually get you a 5% discount on the best dental plan in the market. So really, really easy transition there. I kind of mentioned this earlier, but the dental reference manual, certainly not something I would suggest you bust out in every appointment, but as the name implies, great reference if you've got some detailed questions. And I agree, great cross sale. And then in Nevada, again, I don't know if any of you write in Nevada, but since we're here, a couple of more slides. Okay, it's going to have 3 instead of 4. So we don't have the Premier there. We have the Preferred, Standard, and Economy. And instead of it being percentages on any of it, it's all set dollar amount. Still has no deductible, no cap. Still uses the Emeritus network for in-network. They can still go out of network if they want. But also notice, instead of having 0 wait, Basic has a 3-month. Major still has a 12-month. And then the rider's a little bit different. No hearing, just vision, and it's up to $50 per person per year for eye exams. And then vision correction ramps up over a 3-year period from 50 to 100 to 150 third year and beyond for the glasses, contacts, so on and so forth, and still maintain that relationship with VSP. Okay, so let me go ahead and stop sharing my screen. I know that was a lot of information. I definitely wanted to leave a little bit of time for any more Q&A that we might have. I do appreciate the questions in the chat thus far. What other questions do you guys have, whether it's about our MedSup, our dental, or anything else for that matter? And while y'all are thinking of those questions, I know I mentioned it earlier, but myself and Mr. Andrew Saul, a gentleman I work with here at Physicians Mutual, should be making it out to the event there in Tampa next week on Friday. So make sure to stop by and say hi. Feel free to ask some questions. And I'm sure if there's anybody on here who is not yet contracted with Physicians Mutual, Miss Shakita, Miss Darlene would be more than happy to help you in that process. Any other questions out there from anybody? Shakita, Darlene, we doing good?
Yeah, we're doing good. I don't see anything in the chat.
Quiet group today.
I see.
That's
Maybe
all
I'll have
good.
questions for you on Friday.
That is all good. Bring some questions on Friday. Once we do have agents contracted, we send a welcome email. Has a lot of different stuff in there to help you out. We do weekly trainings. So this is just kind of an introduction deal. Feel free, to jump on what we're doing weekly, just to augment everything that we know that you guys are already getting. So. Really appreciate you guys being on today. Very, very much. Looking forward to being able to hang out next week.
Yes. Well, since we don't have, excuse me, Andrew said thank you so much. It was a good
Oh,
information.
yes. Thank you, Andrew. I appreciate that.
All right, so we're gonna wrap it up now since there's no more questions. I just want to thank you for joining us today, Trevor. And like he's been saying, we would like to see everybody next Friday at the Safety Harbor Spa and Resort. And if you would like any information about the event, or if you have any questions, or if you need to get appointed with Physicians Mutual, give us a call at 800-662-5080, and we will gladly assist you. Take care, everyone, and have a great day. Thank you, Trevor.
Thank you, guys. Go Tigers.